My name is Mark Socinski. I'm the Executive Medical Director of the Advent Health Cancer Institute in Orlando, Florida. I am a thoracic medical oncologist, and I'm a member of the Institute's thoracic oncology program, actively seeing a large volume of lung cancer patients, as well as continuing many clinical investigations in the thoracic malignancy space. What side effects should patients expect from alectinib and perhaps some of the other drugs that are currently approved for use in ALK positive patients? You know, we have a growing list of drugs that are approved for patients with ALK fusions. Alectinib was the first following crizotinib. Remember, crizotinib was approved in 2011 based on an initial phase 2 trial. Subsequently, we've had the ALEX trial, which was the first to compare alectinib to crizotinib, but then the ALTA-1L, brigatinib versus crizotinib, and lorlatinib, and the CROWN trial versus crizotinib. All of these have led both to FDA approvals because they beat crizotinib quite handily. And we shouldn't forget about ensartinib, although it's not approved yet in the ESALT-3 trial. This also was a positive trial in favor of ensartinib versus crizotinib in this population. So crizotinib in many ways might be of historic interest nowadays, certainly as first-line treatment. And initially all of the drugs that are currently approved, both alectinib, brigatinib, and lorlatinib, were initially approved in crizotinib failures, but now all three of them have been shown to be superior to crizotinib in randomized trials. Now, alectinib, about a quarter of patients do have serious treatment-related adverse events. About 16% require dose reduction, and about 10% of patients have to discontinue the drug. And the principal toxicities compared to crizotinib are things like anemia, increased bilirubin, myalgias, musculoskeletal pain, photosensitivity, increased weight, these sorts of things. And so you have to be aware of that. And obviously alectinib is a drug you may be on for a very long time, hopefully years, as at least in the ALEX trial, we've not yet seen the median survival reached for alectinib, and it's 5+ years. And so these patients live a very long time. So, I mentioned brigatinib earlier in the ALTA-1L trial. Again, very similar rate of treatment-related adverse events, about 25% of patients with brigatinib, about the same number required dose reduction. And again, about 10–12% had to discontinue the drug because of these side effects, mostly related to increased creatinine kinase, cough, hypertension, increased lipase. And there's this syndrome of early onset kind of ILD pneumonitis type picture that can happen in the first week. So physicians and patients need to be aware of that. Now, the most recent drug approved in this space, lorlatinib, again, we saw serious adverse events that were felt to be treatment-related in about 30% of patients. About half the patients required a dose reduction. In that case, in the CROWN trial, only 7% of patients required discontinuation of the drug. And this drug is a little different toxicity profile. It has the lipid issue with hypercholesterolemia and hypertriglyceridemia, weight increase, but probably a bit more disturbing are the CNS and peripheral neuropathy effects. The CNS are cognitive effects that can be seen in these patients, obviously quite potentially disturbing to patients as well as patients' families. So you certainly need to be aware of that. So, I think all of these, it's interesting that all of these are highly effective ALK drugs, but they all tend to have slightly different toxicity profiles and safety profiles. All of them have about the same range of treatment-related adverse events. Lorlatinib tends to be a little higher in terms of requiring dose reduction, but all of them seem to be have about the same discontinuation rates of roughly kind of 8–12%, depending on which trial you look at. So, my standard of care in this setting is alectinib. I use that because I think the ALEX trial is the most mature, and it does show a very favorable long-term survival profile. And I think that certainly it has one of the more favorable side effect profiles. I think the other ones can be given effectively, but have very different toxicity profiles relative to alectinib in this setting.